Okay, everybody, welcome to our New Jersey Healthcare Disparities and Access Inequality during COVID-19 discussion or panel discussion. We are honored to have some wonderful speakers join us today. First will be Senator Vin Gopal, along with Dr. Rachael Evans, Dr. Elshinawy, and Ms. Nayla Caruso. I will do some brief bios and introductions, and then we will turn it over to Senator Gopal first, followed by a short Q&A, and then we'll do a panel discussion with our other three as well. So brief bio, we'll start with Senator Gopal. He is our New Jersey State Senator for the 11th Legislative District, and he serves as the Senate Majority Conference Leader and Chairman of the Military and Veterans Affairs Committee as well as the Vice Chair of the Senate Higher Education Committee, and as a member of the Health, Human Services, and Senior Citizens Committee. He's currently the youngest member and the first Indian American to be elected to the New Jersey State Senate. He holds a master's in public administration from Rutgers, as well as a bachelor's degree from Penn State University. Our second panelist that I will introduce currently is Dr. Rachael Evans. She is the current Chief of Medical Officer at Henry J. Austin Health Center in Trenton. She joined there in 2017. And she provides direct care in women's health, general medicine, and pediatric departments at the health center. She has strong interest in women's health as well as addiction medicine, and she has spearheaded Henry J. Austin's medication-associated treatment program. She did her training in family medicine at University of New Mexico and community medicine, and is also board certified in family medicine. Welcome, Dr. Evans. And I will also introduce Ms. Nayla Caruso. She is a longtime New Jersey resident and a volunteer. She has a focus on lower income and immigrant populations in New Brunswick. She has joined the vaccine effort during COVID-19, and she is very involved in local politics as well. She's worked with underserved populations, the Nigerian, Hispanic, and the Creole communities through her church in New Brunswick. Welcome, Ms. Caruso. Glad to have everybody. And we will start our discussion with Senator Vin Gopal. So, in terms of trying to tackle these broad issues of racial and economic disparities in healthcare in general, but specific to COVID-19, we wanted to focus the first part of our discussion on disparities we're seeing in terms of vaccination rates. A statistic done in May of 2021, just last month, New Jersey State released data that highlighted certain towns with populations over 10,000 people having their first dose vaccine rate of only 40% or fewer, as compared to our statewide average of 62%. So there is a wide disparity or gap. They did identify communities specifically as Trenton, Camden, Newark, New Brunswick areas on that list. And as we know that New Jersey is a microcosm of a national trend, we do have many vulnerable communities that do live here. But sadly, these disparities we do see with these lower vaccination rates have caused alarm. And so the first part we would like to kind of focus on is bringing to light the awareness that there are disparities in vaccination rates. And kind of what can we do about it as an eventual call to action is, how to help these communities get better vaccination rates. So we wanted to hear your thoughts in terms of, what your opinions are, specifically as well as Asbury Park, which is in your particular legislative district. They also were quoted as having a vaccine rate at 48%. And this data was quoted of May last month. So we wanted to know what your opinions were in terms of that number statistic and the statewide, vaccination rate of the first dose.
Sure. First of all, I apologize. I got behind about 3 events ago, so I'm going to park in less than 2 minutes and I'll make eye contact after that. It's great to be with you all. Thank you for doing this. The vaccine rollout process was a frustrating one. And look, it's a lot of Monday morning quarterbacking because a lot of folks were working really hard and going through this for the first time in nearly 100 years. So it was very difficult. I think one of the things early on was because of the historical significance on vaccines and the role they played about 30, 40 years ago in Black and brown communities, I think that was something that wasn't taken into account immediately. I think there should have been a greater education campaign done early on the safety of these vaccines. There are Black communities that have a very negative connotation with the word vaccine as a result of what happened in actual history not too long ago. So that education piece needs to be done. It started getting done later. And the fear of the unknown is always an element for everything. So especially here as it came in vaccines. What we did specifically here in the 11th legislative district is we started doing regular meetings with all of our Black and brown pastors, community leaders, civic leaders, religious leaders, and to start engaging, start trying to find days where we can bring the vaccines over there. It wasn't easy because of the lack of vaccines. And I do think the state did not do a good job early on in strategically protecting vaccines for vulnerable populations. What ended up happening is it ended up becoming, unfortunately, a free-for-all where anybody who had the ability to use the internet better was able to get a vaccine. So you may have had somebody, many months back who was working 2 full-time jobs and simply can't sit on a computer all day going website to website trying to get a vaccine appointment when they may have a significant number of underlying conditions, or could have been a senior, or could have been from a vulnerable population, or all 3 of them, and didn't have access to going to get the vaccine. Yet the 23-year-old smoker who lives at home, who's got time to be on a computer all day, would have had an easier time because they could play around and figure out the internet. So there were significant challenges early on how this was rolled out. Hopefully we learn collectively, and we learn, if God forbid this ever happens again, what we can do differently. Asbury Park and many of the communities you mentioned still continue to have those challenges. It's a constant education campaign. We've actually partnered with Hackensack Meridian and Robert Wood Johnson to get Black and brown physicians and nurses who look like those communities to really talk about the significance of how important these vaccines are. So those are some of the things we do and we continue to do. Obviously we're at a place, life is much different now than it was 4 months ago when in some places you can't even give away the vaccine, they have so many. But that wasn't what it looked like a couple months back. It was very difficult to get it out. We're finally doing better on homebound populations. Homebound populations, our disability community, are those residents who are autistic, all of those, some of our most vulnerable populations had significant challenges accessing vaccines, and they're starting to improve now, but there's a lot that we collectively need to learn and figure out how to do better as this happens again.
It is interesting, you hit the nail on the head with so many of these different populations that are affected. And I do think that in healthcare, people need to trust before they will go ahead, even if a doctor says. And I think the important stress is to have people that are in the community that, somebody who lives there would trust. So a resident, maybe the church pastor would be a better, somebody who they would listen to. Versus somebody else. In terms of, you did touch upon the challenges early on with technology. If somebody did not have a computer and they were not able to, as you said, be on 24/7 trying to get a vaccine slot appointment, and then maybe the challenge of even having no transportation. I think, what can the state do in terms of trying to get better access for these vulnerable populations to have, the vaccine rate go up?
Yeah, I think that right now, and I believe they're starting to do it. I still don't believe it's a cohesive approach. I believe it's a kind of every person for themselves trying to do it. So I'm here as a state senator for 18 towns in Monmouth County trying to figure it out here in Monmouth County. As a result, it makes it much harder to if every 600 communities, 600 municipalities, if everyone is doing this on their own, it makes it much harder. And I think that was a big challenge. So I think we need to continue in our county right here in our area. We have Monmouth County. We've got federally qualified health centers that are doing incredible work. The VNA, Visiting Nurse Association, and OHI, Ocean Health. We also have Robert Wood Johnson, Hackensack Meridian, and Central State Hospital, and all are doing really really good work. So I think it's important that they continue to focus on those vulnerable populations, those minority populations, those the disability community, the homebound, again, folks that can't leave their home, can't wait online. I think collectively, I hope and we are pushing the state to continue to focus on that, and hopefully they are.
So, and then bringing up the point of the statewide rollout versus, these vulnerable communities, I guess it's probably different now than it was initially when the vaccines were rolled out a few months back. Have they improved in terms of maybe solving some of these challenges, such as transportation or getting access? Are there like mobile units that could potentially be dispatched to certain communities and get vaccinated?
Yep, and they're doing that. We started doing days in different churches, in different communities, Long Branch senior centers, things like that. We're doing day in, day out to try to get folks to come. You don't need an appointment now, and we're trying to make sure they come back for the second appointment. But the VNA especially has been doing a really good job with the mobile vaccine units, and they've been talking about homebound now for 6 months. So we're getting there. I think right now it's less about the availability, at least in our area of the state, less about availability and access. It's more just about convincing people who haven't gotten it that they should get it.
Right. So that is an interesting point you bring up about trying to convince residents to get it. And I think, are there certain campaigns, as you mentioned, you touched upon having physicians and nurses that, people of color, minorities to speak about that. How has the messaging changed now, I guess, it's now June versus 5 months ago when they were starting to roll out the vaccine to kind of target these vulnerable communities or populations? Is there campaigning or, unified messaging going on?
Yeah, so there's a lot of education campaigns doing. I think what needs to be done is it's really hard. You can't ask if someone doesn't want to say they haven't been vaccinated. You're supposed to still wear a mask. It's really hard to, if they truly don't want to get it, they don't want to get it. But what's important that they don't fall into misinformation, that they have all the data, they have all the facts. And I know the governor and the state have put out different campaigns with wineries and breweries and things like that. But I think outside of that, and that's more obviously geared towards a younger population, the data in itself is pretty fantastic. And we've all seen it. It's that the COVID-19 is continuing to spread among unvaccinated communities. And those who are vaccinated, who are getting the virus, are getting minimal to no symptoms almost across the board. We're talking about millions upon millions of people who have been vaccinated. There's one case study alone in New York recently where seven people got the virus in a crowd of a family gathering of 20, and all seven, they were the only 7 out of the 20 that were not vaccinated. And so I think because we continue to get the facts out, not just by people who look like those communities, but as we get the facts out, I think it's extremely important that people recognize that the truth is on the side of science here.
I think that brings an important point regarding science. It's very hard to convince when somebody has mistrust, trying to convince somebody to get it. So I think campaigning is important to try to, bring in those populations that may not believe that this vaccine works, or fear of, the unknown, as you mentioned earlier, and also fear of history of, vaccine, certain minorities were targeted to test, scientific experiments and things like that. And I think that it's hard to kind of wind back the clock and create trust. But I guess going forward in the future, is there any lessons we could have learned from this that we would hope to not repeat in the future? Oh, I think we're unable to hear you. I'm sorry.
That's okay.
Better.
Sorry. I think Neha, we should have targeted, and I think that was the most important thing, is the lack of targeting we did. We opened it up on the internet, and we all knew of people that were getting vaccinated that probably could have waited a little longer. Look, I have underlying conditions, but I've obviously waited to get vaccinated until we knew seniors were protected, and I know a lot of people who did do that, but unfortunately, because of how easy the open system was, we really weren't able to target vulnerable populations. What we should have done is really look at those employees who are supermarket workers, restaurant workers, the folks that are working full-time jobs that don't have the time to go get an appointment. They should have been protected and targeted first. So there's a lot of lessons I think we should have learned, and hopefully we will learn. Again, there was a lot of mistrust, I think, but really when we look at the end of the day, and we're several months in now, really the vaccines have been God's work, an incredible job by the folks who have been doing them at Moderna and Pfizer, et cetera, and the other companies who are really working to protect folks. So I think moving forward, if this happens, we have to put together a system on how we're going to protect our most vulnerable residents, not just let it be a free for all.
And I think that brings up a good point regarding access, which is what this forum is more about, is the disparities in healthcare and access. And we're spotlighting COVID-19 today, but eventually we'll be discussing other issues as well. So I think, what can we learn from this? And even residents like us in New Jersey, how can we help these vulnerable communities or populations? What can we help out with and create a positive environment to facilitate the increasing the vaccination rates?
I think we just all have to collectively, if there are communities or areas that you know of or any resident knows of that hasn't been vaccinated that wants to be, obviously you can reach out to my office at Krishna, if you don't mind just putting the contact info in the chat, or reach out to any of your government or healthcare officials, because we should be working to set a day, especially for those that have transportation challenges, to make sure that they have the ability, as many options and opportunities as possible to get the vaccine.
Absolutely. And one final question regarding, let's say, statistics. I'm assuming we in New Jersey State are collecting data on vulnerable populations and making sure that we do increase vaccination rates for them. So do we have an end date or a goal in mind of a benchmark that we would like to achieve for these populations?
I think it's as close as we get to herd immunity is going to play a big role, and obviously the minority communities and those that are in certain areas of the state are playing an important role in that. I would say as soon as possible. That's the goal. Hopefully, at least by the end of the summer. Again, we're seeing that the vaccines do work, and we're seeing that they're overwhelmingly protecting individuals. And we just have to collectively combat. I mean, it's amazing how many people I've come across who, whether they're local elected officials or different folks who I believe are overall very rational in all other aspects of life when I deal with them, still have some hesitancy towards vaccines. And I think, unfortunately, that has just been an incredible misinformation campaign. I'm not sure why or how that happened, but it looks like it's been here for a while, and it's only gained strength for a while. So I know that I know that we'll have to continue pushing on that front.
Absolutely. And I think another issue and a point that I'd like to stress is, I know the governor has lifted many, mandates, as we've been going on the last few weeks, indoor dining, outdoor, when do you wear a mask, when do you not? But I think for these populations, their health risk is still very, very up there versus somebody who's vaccinated, of course. So if we have an end goal of, I know, President Biden said by July 4th weekend, his goal was to get up to herd immunity. But how are we doing in this state maybe right now? We only have a few more weeks to go till July for these populations.
Yeah, the governor's been pushing. He's been out, I know, almost every weekend on campaigns. He's been, in addition to some of our Black and Brown communities, our younger residents, overwhelmingly 18 to 25, still have a lot of work to do. So I know they've been putting a lot of different programs, a lot of different campaigns, and we're trying to get folks familiar with someone they know who got vaccinated that they trust to really do that. If you look at some of the NBA, National Basketball Association, throughout their playoff games, have done a good job because they've been putting prominent NBA players and coaches and people talking about how important the COVID-19 vaccine is doing. I think we need to continue to do that and try to use local influencers, pastors people respect, community leaders they respect, and really show them that this vaccine is healthy and safe.
I think that's the biggest takeaway is for us New Jersey residents, we want to make sure everybody is safe, not just the people who have better access to get the vaccine. We want to make sure all residents have equality or equity in healthcare, and that's what we're trying to highlight today. So we do appreciate, your thoughts and sharing a little bit about what, behind the scenes, what goes on, difficulties and challenges, as well as ways we can improve, and hoping that we're prepared, God forbid, there's another pandemic or an epidemic in that sense too. So we did have, there's some comments or questions, but Briefly, I know you have to leave soon, but somebody posted a comment regarding Assemblywoman Reynolds Jackson. She has been personally calling many people to encourage them to get vaccinated. So do you think that if more legislative, people in our state Senate and the legislature are personally calling residents, would that impact them to convince?
Yeah, we hope it does. I mean, we've been collectively, at least on the Senate Health Committee, we've been doing that. I've got about 5 staff members, and we've done thousands of calls to constituents asking them if they'd like access to a vaccine. And we really tried to focus on many of our senior populations and vulnerable populations in Asbury Park and Neptune. We've tried to make it easy and utilize a location very close to them, offering transportation. And then we're trying as hard as we can on social media to continue to push it out there. I wish there was a better way to know exactly those individuals who are not vaccinated, so we could try to do a better campaign towards those individuals. But obviously, that's hard because that's personal information for a lot of people. But we're working the phones and trying to at least make the option available and see if they're interested.
Well, that's really, I think just bringing to light these challenges that we're facing still. And I think, the goal today was to spotlight these disparities specific to COVID-19 vaccine. And, even eventually we're going to discuss, access for healthcare in general. But, I think people, we want to learn, and we're sharing this on Facebook Live of, what can New Jersey volunteers do to try to help out? So I think what I'm hearing a little bit of your messaging is regarding the vulnerable populations, having people who they can trust or connect with. So not necessarily doctors or nurses in that sense either, but local community people that they trust.
Yeah, 100%. And I think that helps with that whole fear of the unknown study that we've known about for decades, as it involves different areas of life. The familiarity will help. And so if they have somebody they know and trust or like, whether they know them directly or they know them because they're a celebrity and they're doing it, I think it does go a long way in helping. Studies have shown that.
Okay. Well, we really appreciate your time today, and I'm looking back through any other questions briefly. Yes, somebody also had a comment regarding it is primary season, as we know. Can you talk to your district committee people into spreading vaccines during their regular get out the vote volunteer hours? Having vaccine as a vaccine site, I think, is what they mean.
I would love to, but I'm a registered Democrat. Monmouth is historically Republican, so we don't have a lot of primaries here. Our elections are in November. So otherwise, I'd be happy to.
Just a thought. We thought we'd try.
Yes, if we could get committee people, I would absolutely try to get them to do that 100%.
It was a nice thought, though. And then somebody had a question regarding individuals. Are they asked to provide government or photo ID to receive the vaccine? And what are we kind of doing along those lines to alleviate these fears for the undocumented immigrants?
Yeah, so we're working. First of all, it's an internal database, so it's not used in any way. We've helped to vaccinate, and especially in the Red Bank and Brill Borough areas, hundreds, if not thousands, of our undocumented residents. And any form of identification is accepted. It's only used for data purposes to study exactly what we're talking about today. It doesn't go into any federal database. It doesn't go into any state database. It's going specifically to see how we're doing in specific areas. And each of these agencies, whether it's a hospital or an FQHC, they all need to report the data up. So it's really it's really used for the purpose not of getting people's personal names and addresses, but really understanding those demographical challenges that we have.
Okay, well, that's good to know. And somebody had a comment regarding health centers. You mentioned the FHQC. Public health entities do not require government photo ID. County and municipal Department of Health generally require proof of residency. It can be a bill with a local address, etc. So would you agree that that's if somebody was getting vaccinated in your township?
I think it varies. I don't believe that's the case. I know, for example, our hospitals that are doing it, you can come from anywhere. I believe in some counties early on, they were limiting it to county residents. Other counties were not. But our federally qualified health centers, which there are a number of them that are doing vaccines, you can really be from anywhere in the state of New Jersey. I do know at one point, many of them were requiring that they be New Jersey residents. I don't know if that's still the case or not.
Okay. All right. Well, we really, really appreciate your pulled in different directions, but the time you took out to share your thoughts and, messaging for improving the vaccine rates for these vulnerable populations. And, we look forward to, maybe having a future forum and further discussion on this topic, and maybe even revisiting in the future and seeing where we have been and where we will go.
Would love to. I really appreciate the invitation. And thank you guys for having this discussion.
Thank you for sharing your generous time. We appreciate it. Thank you. Okay, so we are going to move on to our next panel discussion, which I've already introduced two of our panelists, and we have one more to introduce. It's Dr. Elshinawy. Dr. Elshinawy, just bear with me 1 second. She is a board certified pulmonary and sleep specialist. She graduated from UMDNJ School of Osteopathic Medicine, which is now called Rowan School of Medicine. She is currently on medical staff at Princeton Health Hospital, and St. Peter's University Hospital. Welcome, Dr. Elshinawy. And she has had experience of actually taking care of these COVID patients in the hospital since the pandemic began. And currently she's taking care of these patients after a year with symptoms that are long haulers. So she has unique perspective to share with us on that as well. So welcome all three of our wonderful panelists. Thank you for taking time out today. So we kind of touched a little bit on, I guess, shedding light on the vaccine rollout process earlier with Senator Gopal. And now we're kind of going to maybe change gears a little bit, but along the same lines. We did talk about disparities of the vaccine rates, how we're noticing these vulnerable communities. We have statistical data to show that they're definitely behind, and how can we improve those rates to catch them up? So I think I'd like to start a little bit with asking very broad or general questions, and then I'll kind of turn it over to all three of you to, share your opinions and thoughts on what experiences you have had. So kind of the first set of, let's say, questions or topics I was going to go into was, how has COVID-19 impacted the communities of color that you have all been serving in your experiences, with access to healthcare and even the vaccine, as Senator Gopal had mentioned earlier in his talk. And I can call upon, or if you want to feel free and jump in, we want to make this as much interactive as we can. So feel free, whoever wants to put out their thoughts.
I guess I could start as the least expert on this particular category. I would say in New Brunswick, what I've seen, like on the ground level, looking at people's access to healthcare, is I've been realizing these same communities that are not able to access the vaccine directly or testing directly, they have all along not had access to healthcare. For instance, it became really clear as we were going that almost all the pregnant women we saw at any clinic, not one of them even knew about Eric B. Chandler, which is our local health clinic that they could have been going to. So as often I was handing out information about the vaccine, I was also scribbling down, because I didn't have business cards, information on where they could go to access routine childhood vaccines, prenatal care. These things are just as hard to get as they ever were for folks in our area. So.
Very good comment. Dr. Evans and Elshinawy.
Yeah, hi, thanks for having me. So yeah, I completely agree. At the beginning of the pandemic, it was just hard enough keeping up with all the COVID patients we were seeing, but I definitely noticed a difference in how just the COVID illness impacted people of color, and how the severe complications they were developing compared to Caucasian patients with COVID. And unfortunately, it's the same communities that also do not have access to the vaccines or are very distrustful of it. And I'm sure we'll talk about that in a little bit. But I do find some of my patients who, in certain communities, they will delay going to the hospital if they're sick. They're very distrustful of the healthcare field. They feel like sometimes their symptoms will be underestimated, will be played off, they'll be sent back home. if they tried to present to the emergency room. So they figure that, we'll just try to suck it up and just get better at home and, maybe contact their doctor. And we've seen with COVID that the more you delay the care and the medication and intervention, the worse off you're going to be. Not only could you possibly die of COVID complications, but you're more likely to have these long haul symptoms that we're seeing a year out now. And the second half of this pandemic is the challenge that I've been faced with in trying to reason and convince patients to get the vaccine. And I've had really good, candid conversations, especially with Black and Brown patients, and they've educated me a lot. We know the history of these horrible experimental things that they've done, but to hear it firsthand from people who are descendants of these folks really touched me. And so it's almost, I understand more of why they're refusing and very distrustful, as opposed to, oh, they're being unreasonable, they just don't know any better. So I was really educated through this process. So I try now to be even more patient and more sensitive when I discuss this, because they do have all that just baggage of insecurity for the healthcare system. And it's not just about history, it's about what they face every day, whether they go into the emergency room or go to a doctor's office, and how they're judged and treated differently. So those are very big barriers and challenges as physicians that we have to overcome. And all I can do is kind of have a conversation with one patient at a time. But also what I've been trying to do since December, since the rollout, and the senator kind of touched upon this too, is to really address one community or one specific population at a time, because then they have kind of each other, they hear each other's questions and concerns. And if one of them is convinced, the rest are kind of convinced. So it's really, I find that much more helpful than just talking to a diverse group. So I've been invited to talk to schools, or to set of teachers, or to libraries with, housewives and moms. I've been invited to different mosques and to give, talks about the COVID vaccines to their congregation, but with a religious leader there with me on the panel to kind of say, yeah, I'm with her on what she's saying, because I can just talk until I'm blue. And unless he's kind of okaying what I'm validating what I'm saying, they're really not going to accept it. And so we've been very successful in getting those people vaccinated, but it's a lot of work. It's just one group at a time, and it could be a group of 50 or a group of 100 or 20. But any one person I can convince, I consider a success, because I think they also set an example for other people in their lives, their neighbors, their family, So I'm not just reaching that one person, I'm hopefully reaching a lot more. So I've talked a lot, I'm sorry. So it's just.
We appreciate your perspective. I think, each of us has a unique perspective and a set of experiences. So absolutely. And thank you for sharing yours. I'd like to invite Dr. Evans now to share her experiences with Henry J. Austin.
Thank you. And thanks so much for inviting me. I think, as we've already heard, the COVID pandemic has done a really excellent job of shining a bright light on inequity everywhere, on racial inequities, on economic inequities, on all the different challenges there are to accessing healthcare. And of course, we saw in the Trenton area, we saw all of those differences in outcomes. We're not over. The pandemic is not over, just to be clear. But from where we sit looking at the past year, the demographics in New Jersey, and race and ethnicity is complicated, obviously, and how it gets broken down when we're collecting data is very oversimplified. But if you look at the demographics in New Jersey is about 72% white. And if you look at total cases up to about now, it's about 42% white. So it's an enormous difference in terms of who is catching COVID to begin with. If you look at Black and Latinx communities, definitely disproportionately higher rates versus overall demographics in the state. And that was just in terms of who caught COVID. And that's based on test results. So you have to remember, these same populations we're talking about didn't have equitable access to testing. Our perspective in Trenton early in the pandemic was we rapidly transitioned to telemedicine and really tried to make that care accessible anywhere. You didn't have to come to the center. You didn't have to have a laptop. You could call us and we would do a telephonic visit. And it was our staff were so overwhelmed, call after call, extended families, no access to testing, no resources whatsoever, all of them working frontline jobs. They couldn't stay home, they couldn't distance, they couldn't quarantine, and none of them got tested. So all those people that we saw early in the pandemic are not in those numbers, and the numbers are still astounding in terms of those inequities. And I think I was thinking of this earlier when Senator Gopal mentioned the rollout. The rollout is a fight that happened. We really do have a lot of vaccines in the state right now and a lot of ways to access vaccine. And as Dr. Elshinawy said, we'll talk about hesitancy in a little bit. But when we chose in New Jersey to decide how to roll it out, there was discussion of, should we be pro-equity? Should we be anti-racist? Should we try to strategically make this vaccine more accessible to people who we know are going to have a harder time? And the decision was no, because that will be too politically unpopular. That was not a fight that anybody felt like they could fight. And that's really, I think, when we talk about political action and what we've learned, it is so hard to outline these structures, which are there plain as day when you look at data, but they're so uncomfortable for all of us to talk about. And at every point along the way, they result in inequities, whether it's catching COVID, whether it's having worse outcomes, whether it's having a hard time accessing care, whether it's getting the vaccine or choosing not to get the vaccine. And that hesitancy piece is so complicated in so many ways. And then I think, again, when we think about what are the fights we have to fight, vaccination is really important. But as everything's opening back up, as we've already heard, the unvaccinated among us are still just as vulnerable as always. And so if you're working in a grocery store, working in a restaurant, and you've chosen not to be vaccinated for all the good reasons that there are, you're still just as vulnerable when the governor says everybody can take off their mask and come crowding inside. And the other piece that is so important is the ability to be remote. So many of our members in our community could not work remotely. And what's happening with the end of the state of emergency, this is such an important time right now politically, because all that protection goes away. Once again, if you become sick, you can't afford to stay home. You won't have access to childcare. If your child becomes sick, you can't afford to stay home. And so all those structures that help people do the things we needed to do to curb the pandemic are disappearing. But as we know, unvaccinated people are still just as at risk. That means that it's going to become a pandemic that's happening to those people who've always had less access. And it will be sort of inequitable in its results once again. And again, I apologize. I think we're all very excited about this topic. So let me talk a lot.
Great discussion to have. I mean, we're honored to have everybody. And as I said before, we all have unique experiences and to share and perspectives and that's why we're here to learn, is to get these viewpoints. One thing I thought was important was we're talking about the vaccine or rolling back the mandates. The governor is rolling back many mandates in the last few weeks, and the goal is, but let's say by July 4th, to really open it up as if there was no pandemic. But as we all know, we discussed the rates of vaccination, they're still very low. And I tried to ask Senator Gopal, earlier in terms of discussion, is there an endpoint for goals for these minority populations or the underserved people of color? Do we have a target date for them to get their vaccines? I mean, it's hard to reconcile that on one hand, our state is opening up completely, and yet we still have this vast disparity of, and how do we access or how do we improve these vaccine rates to make sure these people are still protected? Because health-wise, they're still very much at risk, if not more. So, if any of you want to comment on that and what your thoughts are.
Well, I just want to say I was very, very nervous when I first heard the mandates coming out from the CDC. I wholeheartedly disagreed with it. And not to say that another month would have made a difference, but I would have appreciated at least another month because we're working really hard in convincing a few people at a time, but we need that time now. We need that time to, like you said, Neha, we need that time to reach those communities. And if you're opening everything up, and it's those communities, as Rachel said, those are the communities that are out there front line working at these stores. They cannot work remotely. So we have been very, very fortunate as professionals. But so I disagree with the CDC guideline. I was very honest with my patients when they asked me about it, that I disagree with this guideline. I feel like, honestly, let's be very honest with each other. The people out there now wearing a mask are probably vaccinated, and the people that are not are very happy to take their mask off and happy that they got away with not getting a vaccine. So the whole honor system, I feel like, is ridiculous. I had to say that because it's a very frustrating point for me that And of course, I know it's politically driven, it's financially driven, budget, I get it. I get the reason, and it's also an incentive for people to get vaccinated. But I don't think it's a big enough incentive because people could just choose not to get vaccinated still and take off their mask. So I think it backfired. It wasn't very well thought out. So we do need the time, but now we're kind of, they put us more at risk now as clinicians and as people facing these communities who now have even less access and have more access to people that may have not been vaccinated. So I think, could we see like a tiny little wave again? Absolutely, absolutely, and especially people with traveling right now. So I think now we're kind of going uphill now. We have even more of a barrier since they did this mandate.
That's a very interesting perspective, and I totally agree. It's almost hard to reconcile this vast difference, you know, and so I was wondering if, you know, Dr. Evans, you had comments on that along those lines as well.
Yeah, I agree. And I think it's one of the things for us in healthcare that's been such a challenge is that we don't have a single unifying national, state, local message. And we haven't put our faith in public health or our funding, more importantly, for a very long time. And so I think throughout the pandemic, even what comes out of the CDC has been so confusing and also doesn't always speak to what's happening locally. In Trenton, we have, I think Mercer County says 60+% of adults have been vaccinated. In Trenton, it's only about maybe 40% of adults have received one vaccine and only half that rate in Black and Latinx communities. And so it just doesn't make, it doesn't make sense to use the same guidelines for different communities because COVID doesn't stay out of a community because the community around it is vaccinated. That's not how it works. And I agree, I share that frustration. And I think the other thing is that we're talking about what to do next. It is such a long fight now to encourage people to be vaccinated, and it really needs to move out of healthcare. A lot of the people who have chosen not to be vaccinated are choosing that because they don't trust their government and they don't trust healthcare for excellent reasons. And so as much as we can try to spread those messages, and individually, Senator Gopal and myself and Ashgan, we're doing all these things, but we also know that it really ideally would move into a different public space and a space of a different kind of influence. So having more time would be great. And then I really worry about families with parents who are working, who have frontline jobs, who have chosen not to be vaccinated or haven't just had the time to go get vaccinated, are worried about being sick and can't take time off. What's going to happen as everything sort of opens up again and they really don't have those protections? I worry about that a lot. I think when we talk about what can we do, really looking, as always, lack of access to healthcare, lack of access to transportation, paid time off, safe remote work. These are all protections that a lot of our community members have never had, but will go away even more when the emergency ends.
That is a sad reality, but you know, Ms. Caruso, I would wonder if you had any thoughts or opinions in terms of these disparities we're seeing.
Well, when it comes to, sorry. Well, when it comes to repealing the mask mandates, I'm very frustrated with it. I have 4 children. So I have one that's 4, one that's 7, one that's 11, and one that's 14. And obviously at this time, no children under 12 are vaccinated, and they can spread the illness. They can be silent carriers. And if you're talking about these communities that are underrepresented in the vaccine rates at the moment, Black, brown, poor, all the different kinds, they also tend to be your multi-generational houses. So you send, if they're not vaccinated, you send the children back to school. Community spread happens in the school because none of those children are vaccinated. Even if you had the miracle that all the staff and all of the teachers were vaccinated, there's still other children. And they bring it home and then their entire household is sick. And who knows where it can spread from there. I just feel that we were going in the right direction, and I think we're going to lose all of our progress. And I'm terrified of September. Since I just heard the last 2 days, Fauci said we might be able to get all the kids under, like, down to the age of 9 vaccinated by Thanksgiving. That's like the earliest. And that's the people who are willing to have their children vaccinated. So exactly. That's the one I'm most afraid of. In terms of addressing disparities, I believe that it was Dr. Ashgan mentioned that, you know, these people are working off hours. The people that our frontline workers work difficult hours. They have maybe limited transportation. And yet most of our clinics, the retail clinics, the hours at your CVS and your Rite Aid, they're all in the morning. Often they don't go past noon. So if I'm booking people at a retail clinic, they're just, you know, during the weekdays, maybe on the weekends, they might be able to make it. What we really, really need are those clinics, those pop-up clinics that are in the middle of these communities, that are on weekends and are in the evenings. And I mean, there was a wonderful one in New Brunswick. We have a local Mexican bakery, has a big party room in it, and the Mexican consulate comes there and has passport renewals, and they hosted a clinic in the bakery. So people would come in, get their ice cream, get their vaccines, and they hosted it at hours for that community. And that's an example of a community doing something for itself. And when we listen to them, they do it right. They know what they're doing. So I think that's our best way.
I actually agree with you. I feel like that's more of a grassroots level, and that's kind of what we're hearing today in terms of messaging. Is, as Senator Gopal mentioned too, this, where do you get the trust? And in the Mexican community, they're only going to trust their own, let's say, maybe not an outsider. And as Dr. Evans and Dr. Elshinawy have mentioned, that I think, getting them to trust is one thing that's a hurdle. And then also the access. We talked about transportation. We talk about, as you mentioned, the hours are not convenient for people who have essential worker jobs. They might be working a second or third shift. They come home and they have to sleep, and then they can't go and get vaccinated. So we're not making it easy for them in terms of the rollout. So along those topic or guidelines, I wanted to ask each of you kind of what do you think maybe specific challenges in these immigrant populations are? We've kind of already touched on some, and also in your local experience of your patients you were treating or communities, how do we address these disparities in terms of, now we've identified these problems, mistrust, skepticism, how can we move forward, or how can we improve that? Any thoughts or ideas? I'll throw it to anybody who wants to answer first. Let's start with Dr. Evans first.
Thank you. So I think, and there were two interesting questions in the chat as well. One about the absence of physicians or medical care providers who come from or look like the communities that we're speaking of, and the whole question of equitable access to healthcare for all, whether through Medicare for all or just sort of expanding healthcare. These are all pieces of the puzzle. And of course, the structures that maintain inequity are very, very complicated, and none of these is a single solution. And I think the same answer is true for when you talk about whether we're talking about immigrant communities, whether they're talking about different communities of color. It's not a single solution. Of course, having equitable access to healthcare would be one single solution. It's enormously complicated to get there. And we've clearly put all our faith in privatization many decades ago. So that's a long fight, and let's keep fighting for it. Great, because healthcare absolutely is a human right. But I think when we're talking about the struggle to get vaccines accepted or vaccine hesitancy, just as we're hearing, and Neha, I think you said this a few times, it's different. The narrative is different. The concern is different. So one thing I don't want to forget to mention for our in Trenton, I can speak to our more recent immigrant communities, and in particular our undocumented communities. There's a lot more vaccine acceptance in terms of people willing to get the vaccine itself. There's a lot of understandable suspicion and mistrust of anything that's federally funded and all the different sources of funding. And so remember that when we talk about the vaccine being free, what that means is the federal government has committed to paying for it, which is great. But as we heard Senator Gopal say, the federal government requires that states report, and the states all have to report. And each and every one of us right now who's giving that vaccine, get it from the state or from the feds, and we have to report data. So we have to ask everyone who comes in this exhaustive list of questions about their race, their ethnicity, their income level, their legal status. Even just being asked those questions is very anxiety provoking. Someone mentioned in the chat earlier that these large centers for vaccine are staffed by the National Guard. That's also very anxiety provoking. Each of these things makes it less and less likely for someone to feel comfortable going to a vaccine location. And one of the things that we've worried about as a health center, and I know other health centers in New Jersey have, is if we are giving vaccines for free to someone who's undocumented, the source that pays for that vaccine and the administration is what's called the HRSA portal. It's a federal portal where you're supposed to put the information in, and they fund it that way. We don't have any confidence that that portal is confidential. So as a health center, we can usually say everything you give us is confidential because we don't do that level of reporting. We don't send individual patient data to the federal government, but this process requires that. And whether you're getting your vaccine from a pharmacy, from a state health department, from a federally qualified health center, from a hospital, from a private clinic, they have to put that data into that federal database. So one thing that would be really nice legislation-wise would be to say some sort of guaranteed safety of that data. Because as our administration changes, we know that many of our patients feel less or more comfortable with what's happening with their data. So being able to say truthfully, this data is safe, we will never share this with someone who's going to share it with ICE, is an important thing to be able to say. And then the other thing is, you know, as we talk about trusted sources, at least in Trenton, we're very lucky. We've got many local partners who are trusted sources, whether it's faith communities or organizations like LALDEF, the Latin American Legal Defense and Education Fund, who have done a wonderful job of bringing vaccines to people to vaccines, yes, but really trying to look at making points of vaccination available whenever people want vaccine throughout the community. So it's so variable. It really depends on what the challenge is around vaccination.
That's a lot to digest in terms of the challenges we are facing, and things that I think the fear that these communities really have regarding getting reported as an undocumented immigrant, ICE somehow getting access to their information. I think that's creating a barrier to getting vaccinated. Dr. Elshinawy, do you have any comments or thoughts regarding that as well?
No, I think Dr. Evans summarized it really well, and I completely agree with what she said. And I have faced that with a lot of the communities, like I did virtual webinars with and stuff, and I got those questions like, well, what do we have to show in order to get to the vaccine, and do we have to show we have a place of residence, or will someone come, save that information and ask me questions later on? And they have very valid concerns. And after 4 years of the prior administration, I don't blame them for being completely paranoid. So as a physician, to tell them, no, the federal government has said we are not going to put it in a political database. It's going to be like Senator Gopal said. It's reassuring to hear that from it, but do they believe us? Do they think it's a trap? So I really, as physicians, we've had to wear different hats. Because there's that barrier, there's the language barrier, there's the lack of access to technology. So do we go a step further and say, I did that a couple of webinars after the end, the questions I got from the audience, I realized what the problems were. And so you have to go a step further and not just keep doing webinars. You have to then say, okay, maybe we should have computer set up stations at your local, congregation place or senior center place or whatever, and we will help you register for, this is when we were all having to register and wait and on a waiting list for vaccines. So we did that so that, because they don't know how to get on a computer and do it, some people, and some people were hesitant to do it or just didn't have internet at home. Very simple for us, simple problems, for them, life and death, right? And so you have to figure out the specific problem in each community and try to resolve it. So we had like Sunday sessions for people who wanted to come, and they'd line up and we would register, and we had volunteers and register them one at a time. We had people contact us and we would tell them based on where they lived, 3 or 4 places that were happening to give vaccines that week, and so it was very grassroots-ish. And you're right, and it's unfortunately not a federal thing, it's a local thing. And within the local thing, there are groups like you, wonderful people, that are trying to extend a hand. It's like one of the worst things I've ever experienced in this country. And we unfortunately do not have a unified approach. And it takes groups like this to make a difference. So I thank you all for everything you're doing, and just keep moving forward, because despite all the mandates that are happening, we have to do our best and not lose the momentum to make a difference ourselves.
Absolutely. I think these are all wonderful thoughts. And I think, we are eventually going to open it up for some questions and answers, but we've already touched along this in the past, but about the vaccine hesitancy or this kind of skepticism. And I do feel that, this is more of these grassroots efforts in these smaller communities to get messaging out and break barriers to have them accepted, and also get the access to the vaccine, make it easy for them to get vaccinated. Do any of you have thoughts on, in your experiences with, you've touched a little bit, but about the skepticism and the hesitancy and maybe some ideas of how we as community, people in our communities can get together and help out.
I think that, well, I saw another comment in the chat that says one of the most important things is just continuing to have those conversations. And having them in a way that isn't judgmental, and understanding that people who have fears or concerns about vaccines, they're very reasonable. They're based in experience, they're based in history, they're based in understanding. I think Senator Gopal mentioned misinformation about vaccines, and that's really sort of putting it mildly. We've for decades sort of developed an understanding of vaccines in this country in particular. That's very, very different than how vaccines work or what vaccines mean, but it is what it is. And we all have an understanding. And when we make choices about healthcare or anything, particularly in this country, we don't see it as I'm making this decision for the good of my community, or at least most of us don't. And that's what we've seen throughout the pandemic. So when you're speaking about something that's for the good of the community and for the good of the public health, many people will think that makes sense, but most of us will make decisions the way we always do, based on all our individual factors. And being sort of dismissive or thinking it's a lack of education or being judgmental really doesn't help. People make decisions based on what makes sense to them. And so you have to sort of talk it through and really see, well, what are the areas that they're waiting to hear more about? What makes sense to them individually? What would encourage them or not encourage them to get a vaccine? And then I think, and this is the other part that's so hard for us to make decision making around, the use of a mask or not, the number of people who can go into any indoor space, as we've sort of already said, it doesn't speak to the realities of risk. And so for people who are trying to process risk, one of the things that's so helpful is to really say, okay, so we're not going to worry about our entire community. That's just too much. We can't do that on a day-to-day. But let's think about the most risky, the most at-risk person that I care about, and how do my actions affect them? And so just because the governor says it's safe doesn't mean that I can hang out indoors with my unvaccinated in-laws. So even though I'm vaccinated and 1/2 of my children are vaccinated, I still have to make decisions as if we were unvaccinated when it comes to that very micro personal level. And that should be true everywhere, because everybody's grandparents might or might not be vaccinated. And so that's really just sort of a very simple message as people are thinking about, well, can I do this? The state says it's okay. The CDC says, Fauci says, my doctor says, this, that, and the other. It is still not safe to put unvaccinated people in the way of COVID. And COVID is still very much out there.
Absolutely. Dr. Elshinawy?
To your question, Neha, about the hesitancies, and since December, I've learned a lot, like I said, from communities, and I've learned so many, and I had these assumptions why people didn't want to get their vaccines, but then through the question, I was just shocked, and you had to kind of stop and say, okay, that's what they think for whatever reason, social media, their spiritual upbringing, whatever it is. And it was very, very eye-opening. So I tended, in subsequent webinars, I developed kind of slides where I had like myth and fact slides. So, and just kind of built on that based on what I learned from the audiences and the different communities. And so I was able to kind of upfront address it and then later have questions in more detail based on that. But people were concerned there was pork in these vaccines. People were concerned that it would change their DNA. People were concerned that there was aborted fetal tissue in the vaccine. And it made me research these vaccines much more than I would normally do as a scientist. And I learned where they got that from, the origin story of that. And so I had to educate myself before I was able to educate them. And so it was an interesting process, but there are so many different, there's no two people that have the same exact concerns about the vaccine. They always have a little variant of it. So yeah, you can't judge and you can't make assumptions, and you can't just give up on people saying, well, if they're not going to get it by now, they will never get it, because it's not true. It's just it needs a little bit of time, a little bit of explanation. But there are people who are definitely, no way, Jose, gonna get it. So I've learned also to choose my battles and spend more time on people who are more open to learning the facts. So yeah, I think there was a comment I think Jim made that was very good about the apps. That is actually one thing that I've taken advantage of. He says, apps are very, popular among, a lot of communities, young people, older people. And so we've used WhatsApp on, so much, mostly when there was a vaccine availability in a church or in a mosque or in a pharmacy locally. We would just send a big blast on WhatsApp, and it would reach hundreds of people who will then forward it to their chats. And next thing you know, it was kind of like, all the slots were filled within hours for the vaccines. It was a beautiful thing. And I feel like the vaccine rate was so much higher, partly because there was a shortage of vaccines. Now that there's so much to go around and we're looking to donate it to other countries, they're like, so I feel like, when there's a shortage, is always like, well, I want one of those. So that was another thing we had to deal with. So that's it.
Oh, I totally agree. And I think supply and demand has something to do with it as well. When it's most difficult to get it is when we felt that there were people really more interested. Now that we do have an abundance, you notice also in the media, I feel like they're just not putting out those public health messages as much on TV or, advertising as much about go get vaccinated. They are, but I feel like it's diminished subsequently. And I do feel because of these vaccine mass mandates that are being lifted by our state and the governor making these decisions, these communities that we're focusing on today are tending to be forgotten in the sense that, we shouldn't really be ignoring these poor vaccination rates. We're not where we need to be. There's definitely not near herd immunity. So if we take populations in New Brunswick, for example, and Nayla can comment on that, how can we help improve, if they have skepticism or these hesitancy? I like the story of the Mexican bakery taking a step out and doing an actual grassroots campaign. I do feel that sometimes it takes a village and we need to start in our own villages to make these things happen. So I do thank all of you for sharing your perspectives. And I think we have all learned, of what things are going on in your own communities. And I know Dr. Evans had mentioned in the chat about the Trenton clinics are more walk-up now. They're not necessarily by appointment basis. You do have mobile units going around. So we are improving, I do feel, trying to outreach to these communities. Obviously, we have a lot more to do. We're not nowhere near where we need to be. But I do feel that, I think we're making strides, and it's just interesting to hear from the state senator, the, perspectives of what they're seeing as a legislative body, what's okay and what's not. I didn't feel I got a clear understanding of a specific benchmark of a date that we want to get all these communities to herd immunity, but and I think as time goes on, we don't want to worry about a second wave that could potentially hit these smaller populations that are still unvaccinated. So with that being said, we are going to, I think, start with our Q&A now. And I know I apologize for running a bit over time, but I'm going to have my colleague Nick kind of help us out and guide some questions and see if any of you can jump in and hopefully answer. So Nick, take it away.
If I'm being honest, all the panelists have done such a wonderful job of capturing the questions along the way. So I don't know if there's any questions that have gone unanswered. Yeah, the only one that I found interesting, and maybe it'll open up more of an existential discussion, but so the vaccine currently is free and available to anyone who wants it. To most, we've talked about requiring ID or something like that, or it has to be within a certain community, but there's a lot of discussions around Medicare for all and getting to a point where healthcare would be much more affordable. Is this is the vaccine rollout and the inequities, is that at all a signal that maybe Medicare for all isn't the only solution, that there's going to be other sort of targeted or niche sort of campaigns that are needed to make sure that people can, even if healthcare is affordable, that they can actually get to it and make time to get to it and stuff like that?
I would jump in and say that I think what this has shown us is that we needed Medicare for all before this pandemic, not now. Yes, we need it now too, but we did not have any structures in place. We didn't have it set up to book people vaccines the way we should have. So a bunch of volunteers who didn't know what they were doing were the ones that signed on and tried to pull it together. And a lot of us lost a lot of sleep when it was back in the days of staying up at midnight to 3 a.m. to get 1 or 2 appointments if you were lucky and you were learning the ropes. it should never have been like that. There should have been like AmeriCorps doing it or something. This was, I just hope that we take what we learn from this and we build it and don't drop all the infrastructure that we built for this. We carry it forward, we retool it for the next emergency or just for peacetime, so to speak.
Yeah, and I would say that whole question of Medicare for all, or just sort of recognizing that healthcare is a human right and our government should pay for it. It is politically difficult. And I think, you know, as someone mentioned earlier in the chat, the question is it super complicated? And unfortunately, living within the belly of the beast, it is enormously complicated because of the way the finances work and because of the way we are, you know, this country, as opposed to other countries that have done that successfully. We've got this federal government, we've got these state governments, and we've got this unique brand of individualism and mistrust. And then we've got misinformation campaigns. And I think we can't underestimate that. When we talk about Black and Brown communities being hesitant about vaccines because of atrocities that our government and our healthcare system did a few decades ago, that's very important. But in 20 years, we're going to be talking about how trolls took over the internet and lied about vaccines for decades, and everybody bought it. And then we had a pandemic and we suffered the consequences. And that's sort of the terrible thing that we haven't figured out how to even speak about. When I over and over again talk to different people from different parts of Trenton, and they talk about why they don't trust government, they don't trust healthcare, nobody talks about why they don't trust the internet and the people who tell them vaccines are bad, because they do trust the internet and they believe that vaccines are scary. And I think the other thing, and I heard this in the chat as well, the idea that, well, we've sort of been trying to hide the negative effects. I would say, actually, if anything, we've over-reported on the negative effects of vaccines, under-reported on the scary outcomes of COVID. But we hear more about that fear of vaccines because we believe that culturally, that fits with our narrative. Culturally, dismissing or minimizing the impact of COVID fits with many of us in our narrative, and that's a real challenge. And so all of this it's going to take us a long time to unpack, obviously. And then the other thing I would say to all of you, and I mean this in the nicest possible way, of course, I deeply believe that everybody should have equitable access to healthcare, and I want to change all those systems so that all the systems I work in so that they're pro-equity. But many of the people I know and love who are very much in support of Medicare for all, or however you're going to fund it, the minute they get sick, they want choice. They want to pick their doctor. They don't like who their health insurance offered them. And they spend a lot of time on the internet trying to find the person who they think is the best, because that's how we work as a society, culturally. That's how we work. And pushing back against that is different than the political fight, and it's different than the financial fight, but it's also a really, really challenging one. So, and I agree, so I don't mean to go down another rabbit hole, but I just think when we talk about solutions, we have to remember that we built this, we all built this. And what we can do individually is political, and it's financial, and it's also personal. Because in every conversation you have when you're talking about these things, you also want to say, why do you trust what you read on the internet? Why do you believe what people fear about vaccines? What can we do to change that narrative?
I want to, if you don't mind, Nick, I want to ask Miss Frederick, because she's put in some comments in the chat and it sounds like she has firsthand experience. Can you please, if you don't mind, Victoria, can you comment on your experience a little bit and educate us? If you're able to unmute.
She's trying, I think.
You're going to end up typing for the, oh, there you go.
Okay, I was trying to respond in the chat, but I can't do it. So I was going to say, one, as having been a COVID long hauler and having an adverse response to the vaccine, I think I'm in a unique position on both. And I will say that I still had all my family vaccinated. And also being in the Brown community, I will say to you that I really feel it's interesting when I look in the gallery, and no disrespect, the look of the people telling us to get vaccinated is really hard, because it's not about the Miss Evers boys experiments that happened until 77. It's about the experiments that happened 2 years ago on the kids in Georgia. It's not about, oh, this is how your community feels about healthcare workers. This is about when I was in the emergency room in July, and I'm a nurse, a registered nurse, a BSN nurse with an IBCLC, and the ER doc told me, well, this is not the place for you to get your blood pressure meds regularly. I'm not on blood pressure meds. I had COVID, autoimmune dysfunction. So I know from both sides. First, I understand how vaccines work, but I also understand that I got blood clots from the Moderna vaccination. So I don't want someone to tell me that being vaccinated is not a risk because I'm still on blood thinners. But at the same time, my mom, who refused to get vaccinated, and she's 73 years old, and I'm like, oh my God, you need to get vaccinated. But I also know she also gets inflammation. I do not want her to get blood clots. But I know that once I got vaccinated, and my husband got vaccinated, and my kids got vaccinated, and my brother got vaccinated, and then she calls me up and said, my vaccination's on Thursday. Because it's like, she didn't want to get left out. So there's more to getting community to get vaccinated than just telling them. And I do know that someone got vaccinated and said, okay, they tagged me now. They were kind of joking, but they were kind of not joking because part of them really does think that maybe there's something under their skin. So it helps when they know that I gave out vaccinations and I saw it drawn out and there was nothing floating in the liquid. So I think that is more than just saying we overemphasize what could happen. Yeah, anaphylaxis, yes, they overemphasize. Like 2 people got it and there's like 300,000 people. But they underemphasize that, yeah, a lot of people got inflammatory responses from the vaccines. And they say, you know, oh, you'll just have whatever. And a lot of people needed to go home and take a Motrin after that vaccine to reduce that inflammatory response. Whereas other people, you know, it was no big deal. But if you had COVID before, that first shot was a doozy. If you hadn't, the second shot was more of a doozy. We need to be more open. Yeah, the vaccine, you might be sick for a day or two. It might really suck. But you know what's worse? Dying of COVID. What's worse than dying of COVID is surviving COVID and being on PT for a year. There are worse things than dying. Everyone's talking about, oh, you could die from COVID. Well, guess what? You could survive COVID and be on oxygen forever. That's worse. And I think those are the kind of conversations that we're not having in our communities. We're not saying, hey, listen, you can die. Well, forget you could die. 1 to 3% could die. You could survive and it could screw up your life.
And I think that, and I thank you so much, Victoria, and I'm sorry to interrupt the rest of you guys, but I think someone like Victoria has potential to have so much more of it. Clearly she has an impact on her family already, but clearly has much more of an impact on the community at large and convincing them than a healthcare provider who has not had COVID, very fortunate to not have had COVID, did not have a serious reaction to the vaccine, and then say, oh, it's going to be fine. You're fine. Just get it, you know, and obviously I educate a lot more than that, but she has a much more impactful story because she experienced it firsthand. There's nothing like that. And then as an African-American RN, you know, she has credibility too. And so this is what I'm saying. If we have panels and webinars and stuff, it should be diverse. The audience should be diverse, and the gallery, as she made it very, you know, very, very clearly, should be diverse because they want to listen to people that look like them, just to put it very plainly. So thank you so much, Victoria, for your comments and your story. Really appreciate it.
Jump in. I absolutely agree. Dr. Evans, do you have any comments to what Victoria has kind of gone through?
Just, you know, thank you so much for saying that. And that's exactly the narrative that needs to be shared more widely, because the other challenge is, as you said, when we talk about messaging, the truth is COVID sucks in so many ways. You can die, of course, but it can just mess up your life in a lot of ways. And then I've spoken to so many patients and coworkers and community members who had COVID and were terrified of getting the vaccine for exactly that reason, knowing it lights everything up again. It really makes you experience those same symptoms, and they can be devastating symptoms like a blood clot, or they can be much smaller symptoms like I had fever and headache, and then my sciatic acted up for 2 weeks afterwards. But just saying vaccines are safe and safer than COVID, that doesn't reflect that reality. And so then when you know somebody, as many of us know somebody who experienced a different reality, either, Victoria, as you said, I had COVID and it was awful, and then I got the vaccine and that was awful. That's a reality that needs to be spoken to, because everybody's going to know someone who had that reality as well. And we are just in a terrible pandemic, and the vaccine is the way out of it. But it's not great. It's not easy. And I think we don't want to be dismissive about the pain of all these different things that have happened to so many people and will continue to happen as well.
I just wanted to add to what you said, Victoria, and that I wanted to say that you're 100% correct. I also had COVID. I wasn't a long hauler. It lasted a whole month for me, but then it was over. And the second dose of Moderna and the first dose of Moderna really beat me up bad. I was the worst panelist leading up to this because I spent the last 7 days after my second dose with migraines, which, oh well. But when I'm the person behind, because what I do is I register people for vaccines at the clinics. I check them in, and usually they bring a couple of people with them. And I've taken your approach of when people come up to the desk and there's clearly somebody who's unvaccinated with them, I always upsell. Like a waiter at Applebee's, I will upsell you on your additional vaccines. So I ask if everybody else has it, and you have to level with them. And actually, I've been able to upsell people to J&J mostly, since oddly, the ambivalence I hear the most around here, mostly Hispanic community, is they don't want the needle. They hate the needle. So if you say J&J is 1 dose, they'll take it. But you got to tell them. You have to tell them, it wasn't so bad. I mean, you're tougher than me, and I'm a marshmallow. So, you'll get through it. And I've had more positive results by being honest than by just hand waving like it's nothing.
Very good thoughts.
Okay, and I guess there was just one other question in the chat here from Lisa. She said, is there any mechanism in place for local people to organize vaccination events like the bakery story? And I know that recently Princeton hosted a vaccination event. It was notified to me by a council person. So I'm thinking that maybe that's probably the first avenue, but I wanted to ask if other people had any input on that.
Well, since that's kind of what I've been doing, I'm not the organizer though. I'm just the typist at the front. What you do is you go to an event that you've heard of that's within the local region of you. You find out who's behind that. Specifically, you look for the person whose medical license was the one that the clinic was run under, and then you go and you schmooze them. Unfortunately, this really is a matter of it's who you know. So you have to spread your networks as far as you should. I'm also working on a clinic that's at our church, and they went through the official routes to get things done, where they go to the county board of health and, they go to the state, and it's basically doing it on their own to get it done that way. And it goes slower. And since none of those people have ever run a clinic before, they don't know how to liaise with the county or the state to get it done, to have a pop-up clinic. So it's not that you're doing an end run around the official channels, it's that you're finding somebody who's already done it before, who knows how to do that liaison work with you, and you are getting them to bring it into your community as fast as you can. And I'm sure if you look, you will find that there are local community events that have already been run. You can check your local Visiting Nurse Association's website, and they seem to run a lot of these clinics, and they're who I would say is the go-to if you're trying to just start one up from nowhere.
And I would add, everybody wants help giving out vaccines. So if you think you know of a bunch of people who are willing to take a vaccine, please do reach out. You don't have to form your own clinic. There are people with vaccines, whether it's the Department of Health, whether it's your local hospital, your local health center, whatever it is, there are people out there dying to get vaccines. And if you bring them people, they will be happy to run the clinic.
I would also let you know that the NJ Links, which is NJLINCS, they are dialed in to, and they have a grant in which they connect, just like with the testing, all of the vaccine centers. So for Mercer County, NJ Links is only a resource for all of the health departments. So same thing with the vaccine centers. If you wanted to do a vaccine clinic, or if you wanted to bring people to, let's say, Trenton's pop-up clinic or another clinic, you could call the Links person. There are 22 Links public health nurses in the state of New Jersey. For Mercer is Stephanie Mendelson, and then they would connect you, or they would create the resource for you, either putting you into one of the other clinics or creating a clinic for you.
That reminds me, if you're trying to get a new clinic started, and just piggyback on a food pantry distribution, a diaper distribution, any event where people have already been showing up week after week, you bring that event to anybody that's trying to start clinics, whether it's the Visiting Nurse Association or the county, and they'll want to be there because there's already people getting there. And if you can have any added value to that clinic, provide hot meals. That's a lot of people have to come during a mealtime. So if they have a hot meal, they're more likely to come. And let's be honest, the nurses that are administering the vaccines, they want to have a hot meal too. We are having social workers coming to several of these clinics because we've seen people come in that haven't had other health care that they need. We've got a lot of homeless jobs, a lot of pregnant women who don't have prenatal care access, children that need their routine shots. So if you have your social workers there, you just run them through the line. You give them their food pantry distribution. Actually do that last. They don't want to carry 30 pounds of groceries during their vaccine. Okay, vaccine first, your food, and then you get them through those social workers to get them hooked up with permanent solutions so that from here on out, they have real help and they're linked into the system.
Great idea.
So I think I'm out of questions. It's probably good timing though. So I will pass it back to you, Neha, to just, I guess, wrap things up. Thank you.
Thank you, Nick. Thank you to everybody. I definitely learned a lot, and all these unique perspectives and experiences that you all bring, I think just enriches our community and makes us all want to do better and improve the lives of everybody. I think we definitely have a lot to learn and a lot to do. And at this point, I would say that, I would hope to continue the conversation on healthcare, the inequities, the disparities that we are seeing, structural racism. We want to bring to light all of these issues and, hopefully partner together, because as we do know, New Jersey is literally a diverse melting pot, if I put it bluntly, but we need to make sure that every community and every minority population, everybody is heard and their voices are heard. And, making changes for healthcare, as Dr. Evans mentioned, healthcare is a human right. And by trade, I'm actually a pediatrician. I'm a physician too. But, I didn't come on here today to say, but I can definitely shed light on the vaccine situation in my perspective in my field as well. But, focusing as well on COVID-19. And I do think that starting to kind of bring light to this issue with legislators, hoping that, Senator Vin Gopal, they hear ideas from local communities and grassroots, and they take it back and know that, okay, that's not good enough to, we need to have a benchmark. We need to have herd immunity. We need to not forget about these communities. We're only harming ourselves when we move forward and say we're going to lift the mask mandates and everything goes back to normal. Yet we have not addressed these disparities that we tried to showcase today. So with that, I would like to thank you all for joining and wonderful questions. And, it was a really enlightening and hopefully an interactive, discussion. We did not want it to be like three panelists are presenting and somebody speaking, but, I humbly say that I learned a lot today, and I hope all of you did too. And hopefully we take back some of these wonderful experiences and actually, call to action. We have great ideas and resources here. So I'm hoping that we can really try to implement and work together. But I know we ran over time. I'm so sorry, but it was really enlightening, and I'm looking forward to doing this again and learning some more with all of you. And thank you so much.